let's move on into drug addiction. You talked about that very interestingly, how we have to analyze and we have to determine whether the person is addicted to drugs or they're abusing it and things like that. My question is, now drug addiction, as a medical professional yourself, who handles people with drugs, who are addicts and things like that, how much of it do you see as it being an addiction, or how much do you see, where is your stance on people who abuse it and people who are addicted to it? The number of patients you treat at your retreat, your rehab center, how many of them are actually addicted or how many of them actually abuse? And where is there any correlation or connection between that? Do people start off at addicts and then they start to abuse things and things like that?
Okay, the answer is yes. Now, of course, the patients we treat in the center, in our facility, most of them, I would dare say all of them have an addiction problem. Yeah, they have lost control, they are unable to live life normally, they can't function without the dependency.
Now, you say lost control, so does that go into abuse? Do they abuse the drugs if they really don't have control, or they're addicted to? So I'm just trying to find the correlation, the differences.
Okay, so we like to look at it 3 ways,
Okay.
Use, abuse, dependence.
Okay.
Now, there are 3 things we're looking at.
Okay.
Use is something that you use because you've been prescribed. For example, doctor gives you morphine, the doctor gives you heroin, you use it because you're not well. Abuse is where you use it more than you're supposed to use.
Okay.
3 tablets a day, you take 5. You take 10.
Because the effect is not the same,
Yes.
because you're constantly
Yes.
taking. Okay.
All right, you start to abuse it. Now, dependence is basically when life becomes unmanageable. Okay, I need to use it even I cannot function. So my life revolves around the dependence. This basically is how we would explain or define in simple terms what addiction is. If I don't use it, I can't function, whether it's psychologically or physically or even emotionally, I can't function. That is dependence and addiction. And life becomes unmanageable. That, I think, would be an easier way to define what it means.
Okay, let's move on to your treatment options. So, you run Solace, you run Sanctuary. Based on all of this, drug addiction, what are your treatment strategies for that?
Now, we know and we have seen and we have studied that residential treatment is one of the better options with better treatment outcomes, rather. Okay. Now, we started Solace in Kota Kinabalu in Sabah a couple of years ago, 5 years ago to be precise. And it was meant for international as well as local people to seek treatment. Our thought at that point of time was that we would attract more foreigners, right? But surprisingly, about 50% of our patients are still Malaysians. The cost-wise is in US dollars, so it can sound pricey to the local Malaysians or local Southeast Asians, but people are still coming for treatment. But there's of course another population who need help but cannot afford that high-end treatment, and don't want to go to government-run centers or don't want to surrender themselves for various reasons. So we started Sanctuary for that purpose, to cater to these middle or average income earners for Malaysians, and I must say that we are able to help many people because it's more affordable. Okay, treatment, residential treatment is always better than has better outcomes than outpatient treatment.
Okay.
But with that said, not everyone can afford to stay in a residential setting. Finances, career, work and family. So we also now cater to those who can't do residential in an outpatient program as well. At least it gives them the option to give it a try. And if it fails, you can still go back to residential. So we're trying very hard to provide treatment or help to all levels of people who need it, because we know it's a disease and it helps to be treated.
Okay, now there are a lot of different types of drugs. Does your drug addiction treatment, your treatment strategies, depend on the drug, or you have a one fits all type of situation, or how does that work?
All right.
A person addicted to marijuana, a person addicted to heroin, a person addicted to like synthetic drugs, you were saying. Is there different strategies depending on the drug?
Okay. You see, addiction is a chronic relapsing disorder. This is the way it has been defined, right? Now, it's not about the type of drugs that you use, but it's more about your life, your biological makeup, your psychological makeup, your social, your environment, you're growing up with, the belief system, the family, the spiritual aspects, your values. So it's a complex illness. So it's not about the type of drugs that you use, actually, but it's more about the customizing the treatment approach to your specific needs, psychosocial needs. That's what treatment should be looking at. Of course, the drugs cause damage to the body, biological damage. For example, a person who abuses alcohol would probably need to be detoxed medically. Okay. But a person who abuses maybe marijuana may not need a detox.
Oh, okay. Yeah. Depending on it's a case by case. Yeah.
A person who abuses meth, for example, ice, as we all know today, shabu, which is the second top abused substance in the country, may become psychotic. The chances of him or her becoming psychotic is higher. So that medical and the psychiatric aspect is a different approach. But the psychosocial treatment approaches has to be customized. Yeah? So is there one size fits all? The answer is no.
Okay.
And how do we design or develop these treatment approaches? Through lots and lots of assessments. Evaluations, assessments, medical assessments, psychiatric assessments, psychological assessments, family, lots of interviews with the family, evaluating them and understanding what the environment was that this person grew up in. We take all of this, put it into a kind of a recipe, and then we churn out a treatment approach.
Okay. All right, thank you, Dr. Prem. Final thing,
Yes.
if anybody would want to get more information on Solace or Sanctuary, what can they do?
Please call us. Visit our website, sanctuary.org.my or solacesabah.com. Just visit us, and it's solaceasia.com. Visit us, give us a call. We're happy to help. We have an outpatient clinic. We'll give you an appointment. Come meet us. Sometimes it's difficult for the patient to come for treatment. They don't want to come. They're in denial. Get an interventionist. An interventionist is trained to go to the family, meet them, talk to them, set up a family session with the patient, and bring the patient into treatment.
So that's what you guys also...
We do that as well.
Okay.
Yeah, seek help. Addiction is treatable. We have the technology. The country recognizes it. The government recognizes it. The ministries recognize it. Get treated.
All right. Thank you, Dr. Prem, for your time.
Thank you very much, Dishen. It was a pleasure.
And thank you for watching. We'll be right back. This is Health Matters with me, Dishen Kumar.